Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I am so excited for our program today. I want to tell you right now, let your friends, your family, your neighbors, let them know we are on the air. Community Partners for Better Health is bringing you the health information you and your community need to know so that you can have a healthier tomorrow. We've got two fantastic guests joining us today, and I think you're going to really appreciate the way that they bring this information to you and what they have to share. The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. The Health District offers free diabetes self-management classes for people with diabetes. To learn more or sign up for their class waiting list, visit www.gethealthyclarkcounty.org or call 702-759-1270. And here to tell us more is Rayleen Earney. She is a health educator who has worked at the Southern Nevada Health District for more than 22 years. Rayleen, welcome to the show.
Good morning, Will. Thank you, listeners. It's wonderful to be here.
So glad to have you and have you back again. You're no stranger to the show, but we are always grateful that you come with information that helps to bridge the gap between what we should know and what we do know in our community. So, Rayleen, I've got you on today because March 23rd is Diabetes Alert Day. Can you tell us a little bit more about Diabetes Alert Day?
Yes, I'd love to. Every year, the American Diabetes Association puts together a wake-up call, if you will, and that's to focus on the seriousness and importance of diabetes and also pre-diabetes, and it encourages everyone to take the diabetes risk test so that they know where they stand and they can do things to prevent or reverse pre-diabetes.
So can you explain just a bit the difference between diabetes and prediabetes?
Sure. So prediabetes is a condition where blood sugar is higher than normal, but not high enough to be diagnosed as someone having type 2 diabetes. So blood sugar, if you fast for your blood sugar test, if you get your results back and you're less than 100, then that's pretty much a normal blood glucose test reading or result. And then if your blood sugar is in the range from 100 to 125, that's the range that prediabetes is in, where your blood glucose is higher than normal, but not high enough to be considered diabetes.
Okay, that makes sense. That's why it's prediabetes.
That's right. It's still a serious condition, and there are things you can do to reverse that prediabetes condition.
Now, who is at risk for developing prediabetes?
Really, a lot of people are at risk for developing prediabetes, but it's higher among Blacks, African Americans, Hispanics, Latinos, American Indians, Asian Americans, and Pacific Islanders. And so some of the risks that people have are being overweight, not being physically active, family history. Maybe they have a brother, father, sister, brother with type 2 diabetes. And one of the key factors I found kind of interesting is when women have babies. Sometimes women have higher blood glucose than normal when they're carrying and having their child. So basically, if they have higher blood sugar during pregnancy, they can have gestational diabetes. That means it's higher than normal at that time, and they'll have babies that weigh 9 pounds or more when the baby's born. So that carries a risk for both the mom and also the child pretty much for their lifetime.
Wow. So pregnancy is a risk in that sense if they have the gestational diabetes, but you could also be at risk for your age or simply being overweight. Is that what I'm hearing you say?
That is correct. So all those things come into play when you take that prediabetes risk test. It's a questionnaire that asks you all about those types of risks, and then it assigns a point level, and then you'll see if you're at high risk if you score 5 or higher.
Now, one of the other risk factors is being a man. Can you talk about that?
Well, and we're not picking on men specifically, but in the prediabetes risk test, you get a point for being a man, and then a woman doesn't get a point for that question on that questionnaire. But men tend to carry their weight more so in their stomach area or their abdominal area. And so that's why we have read in statistics that men sometimes, because where they carry their weight, that they can have a greater risk for developing prediabetes and type 2 diabetes in their lifetime.
Thank you for that information. I want to move forward and talk about type 2 diabetes. So what are some of the signs and symptoms once it's progressed from prediabetes to type 2 diabetes?
Feeling thirsty all the time is one of the things that a lot of people notice. Every time you drink something, it's just not quenching your thirst. Also, blurry vision. You can't see clearly. So type 2 diabetes signs and symptoms. Not everyone experiences all these things together, but these are some of the signs that most people can experience. Having extreme fatigue, being tired all the time, having numbness in their hands and their feet. And so these are things that people just dismiss as maybe something else going on. And it is true that we do live in the desert, so people can have dry mouth and sometimes those types of things. But really the only way to know for sure if you have diabetes is to get your blood tested.
Well, we will definitely keep an eye on ourselves to monitor for those symptoms. Now, why is it that uncontrolled type 2 diabetes is such a serious condition for our community, for African Americans in particular?
Yeah, so according to the Office of Minority Health and the Centers for Disease Control, the rate for diabetes among Black African American adults is higher than other ethnicities. And so there were some statistics that came out that I'll just talk about briefly, that in 2018, non-Hispanic Blacks were twice as likely as non-Hispanic whites to die from diabetes. And also in 2017, non-Hispanic Blacks were 2.3 times more likely to be hospitalized for lower limb amputations as compared to other ethnicities. And the reason why that's important is people who have poorly controlled diabetes can have serious health complications such as blindness, amputations, nerve damage, kidney disease, heart disease, and stroke. So it's just very important for to have a great quality of life. You want to manage diabetes so you don't have to have those complications.
You've given us some information about the serious impact of type 2 diabetes. So when we're looking at prediabetes, even the name kind of suggests it's not as serious, but could you talk about how much of a problem prediabetes is?
Yeah, so prediabetes, a lot of times people think of it as just a touch of sugar, and that's a community term that I've heard with some folks. And basically, they don't take it seriously. They think maybe they're have borderline diabetes. That's another term I've heard. But the thing is that 1 in 3 adults has prediabetes, and 8 out of 10 adults who have prediabetes don't even know they have it. So the thing is, if people do not manage or control their blood sugar, they could develop type 2 diabetes with all those serious complications we talked about earlier within 5 years' time. So
Wow.
It's super important to focus on prediabetes and take it seriously. It really is an alarm, a wake-up call to do something about it and adopt some healthy lifestyle changes so that people pay attention to their health, manage it better so that they can avoid those complications and be there for their families, be there for graduations, weddings, all the things, their families, for their kids, for their pets.
Yeah, absolutely. We want to be healthy for those occasions. What should we do if we're concerned, I might have this?
Yes. So if you're concerned if you have it, then the best thing you can do is see your doctor, of course. So number one, what you can do today is take that pre-diabetes risk test, and it will tell you if you're at high risk or not. And then, of course, if you have diabetes running in your family, knowing your family history is super important. So you can talk to your doctor about getting that blood test. And all they do is take your blood and you fast for the test, and then they give you back your results to see what range you're in, if you're in the pre-diabetes range or already in the diabetes range. And if you're in either, then of course, managing it helps wherever you are. You can reverse prediabetes or you can manage type 2 diabetes.
Okay, so you said you can reverse prediabetes, but manage the type 2 diabetes. So is type 2 diabetes not reversible?
That's correct. So that's the difference between the two conditions, that prediabetes is reversible and pretty much type 2 diabetes is not reversible. So once you're diagnosed, you may be able to do some of the lifestyle changes like getting some more exercise and eating healthier with type 2 diabetes. And it may be that your doctor kind of adjusts your medication so you're not having to take as much medication. Those are things that I have seen in some of our folks who take our diabetes classes. They might back off the medicine, but really to reverse diabetes is just really not an easy thing to do.
So it sounds like it's really important to make an effort to minimize risk for this. And it sounds like it's well worth any effort you have to put in so that you can avoid dealing with these conditions in the first place.
Oh, absolutely. And participating in a diabetes prevention program can reduce your risk for developing type 2 diabetes by 58%. So that's more than half. So that is definitely worth it, like you said.
Yeah. And by more than half, I mean, why not try it? What are some things people can do to prevent this?
There are a lot of simple things that people can do to manage their blood sugar or prevent or even delay type 2 diabetes. So starting with walking is excellent. You can take a 10-minute walk, whether it doesn't matter what time of day, and then you build on your time from there. Once you get used to taking 10-minute walks, then maybe you add a few more minutes each time. And what we're trying to get people to do is to be physically active for at least 150 minutes per week. And you can break it down in 10-minute time frames. So you can break it up, and some people do different things, Monday, Wednesday, Friday, that's their day that they're active, and then something on the weekend. But just adding up to that 150 minutes is really crucial, because you can go for hikes, all at one time, and maybe you're hiking for a good time period, and then you need to rest or do some stretching exercises another day, breaking it up, and that's always helpful. So those are things you can do to reach your weight and activity goals, and also reduce stress. That's another benefit of walking and just being active, or dancing. People love to dance. So I would highly recommend that people do the thing that they most like to do, because you're more than likely to stick with that.
And speaking of things we like to do, I know for me, I like to eat. So what are some things I can do with my dinner that would help to prevent this?
Some simple things to remember for dinner is make half of your plate vegetables, and especially the non-starchy vegetables. And so basically you can also do protein. A quarter of your plate should be protein. That could be pork tenderloin, lean cuts of beef, fish, tofu for the vegetarians, or beans. And then the other quarter of your plate should be whole grains like brown rice. Some people like that. And or whole grain pasta. If it says whole grain in the label, then it's whole grain. So you have to look for that in the label. And then, of course, cutting back on the sweets, sharing a dessert with a friend, or not eating desserts as frequently can certainly help out on that as well. And drinking more water, that's always helpful. So that's part of we have to think about beverages too. When you talked about healthy eating, that's always something I think about. And you can, even with the healthy eating, you can make salads and add different proteins to your salads. One day it could be grilled chicken, another day it could be tuna, it could be ground beef, the lean ground beef, and then you add different toppings to it and just go easy on the dressings and things like that. And those can just be simple things you do. Or even go, and if you like to cook, there's a wonderful recipes online at diabetesfoodhub.org. And that's a website that the American Diabetes Association has. And then, of course, we have our Get Healthy clarkcounty.org website, where you can get flavored water recipes, and you can add melons to your water, or a little bit of basil, different types of things recipes where fruit or different things so that your water isn't just plain water. It's something that you actually like to drink, and it will encourage you to drink more water as well.
Yeah, give us those websites one more time.
Sure. So the websites to go to for the healthy recipes are diabetesfoodhub.org. And then the other one is gethealthyclarkcounty.org.
Wonderful. So those are some excellent resources that people can take advantage of to learn more about this topic and to plan their meals. I know planning in advance helps me to eat healthier and stay on track. So thank you for sharing those resources with us.
A few more things I wanted to mention were that the Southern Nevada Health District has put together a free online diabetes prevention program, and you can log on our website, gethealthyclarkcounty.org, and do that at your own pace, and it will give you more tips on how to be more active and eat healthier, as well as to help to prevent diabetes. And then we also teach diabetes classes for those folks who already have diabetes. You can go on our website and sign up on our waiting list, and then we will contact you when the next class will start. And we are actually doing small groups. So we have people distanced apart, and they're wearing masks and everything is sanitized. So we encourage, if you need a diabetes class, please let us know. And you can call us at 702-759-1270.
Wonderful. And now with those classes, are they available in multiple languages or English only?
We have them available, the classes available in English and Spanish as well.
Okay, perfect.
And one thing I forgot to mention was quit using tobacco. Of course, that's a huge risk factor for someone with diabetes. So we have the 1-800-QUIT-NOW phone number on our website as well.
Wonderful. And we do advocate that every show we mention 1-800-QUIT-NOW, because eliminating tobacco use is one of our goals, because we know the health impacts that it has. So thank you for including that in the conversation today.
Oh, it's my pleasure. Thank you, Will.
Absolutely. And Rayleen, I just want to say thank you again for joining the show. It's such a pleasure to speak with you. I know we'll have you back again.
Sounds wonderful. Thank you so much, and have a great day, everyone.
And now joining us is Pamela Atkins Gerard, an advisory council member with the Nevada Minority Health and Equity Coalition. Good morning. Welcome to A Healthier Tomorrow.
Good morning. How are you?
Doing well. Thank you for asking. I'm so excited to have you on the broadcast this morning because of the incredible work that is happening within the coalition right now. So I want to start at the beginning and bring our audience up to speed. First, what is the Nevada Minority Health and Equity Coalition?
What the coalition does is we help to disseminate information in the community to communities of color, people of color, to make sure that they have accurate information.
Well, I think that's an important role that the coalition plays. And I think it's really taking shape and gaining momentum now, particularly around these COVID-19 initiatives. So before we talk about what the coalition is doing, I just want to know, why are you involved?
I started with the coalition back before it was a coalition. And at that time, there was no Office of Minority Health. And the goal was, at that time, was to make sure that people of color had a voice when it comes to their health. So I joined the coalition, the grassroots coalition at that time, to help to make sure that something happened in the legislative sessions to make sure that that happened in our community. So once, due to the late, great Tyrone Thompson, once that information was out there and he got it more into the community and he got more legislators on board, and the SB 242 was written and it passed, then the coalition was formed. The coalition then started to help the people in the community. And I just kind of stayed on. I was not a member of any organization at that time that was a member of the coalition, but I felt that someone who did not have a voice coming from an organization, just an individual community member, should also be a part of this group, because there's a lot of people out there that are like me. that maybe you're retired, or maybe you want to be a member, but you don't want to have the restrictions of your company or an organization, so that people can hear your voice as well. I think it's real important that there are people, individuals who are members of this, just to make sure that we all have a voice in the community.
Yeah, I absolutely agree. And I'm so grateful for the voice you do offer and provide. You're never afraid to say what's on your mind. And so just want to say I'm appreciative of that, because it's important. And I also want to highlight what you mentioned about the community being involved and how you felt it was important for individuals to be a part of this larger structure. Can you talk a little bit about why it's so important that we take health into our own hands as individuals and really make a difference for ourselves and our community through whatever avenues are available?
I think that, again, being an individual member, I talk a lot about my father, and I use him a lot as an example. And a lot of people in the community, their households are multi-generational. So you may have that grandfather, that great grandfather that's there that have some health issues or some concerns. They don't know where to go or how to talk to people about what's going on with them. But then maybe there's that younger person that lives in the household. If there's a coalition that person knows, I can reach out to them, because maybe they're undocumented, or maybe they're just afraid. Maybe there's a language barrier and they don't know where to go, or they're afraid to go to their own physician, or maybe they don't have a physician. So it's real important that there are people like me in the community who can speak. My father calls himself a country bumpkin. He's lived in this community, since 1963, I believe, when they moved here. And he's one of those people that he has his doctors and he will go to the doctors. There's a network of people that he works with through his church, and they all sit around and they talk about what's going on, things they don't like, but they don't know who to talk to voice those concerns to. So I also represent, I guess we could say, the seniors in the community, because they need to have a voice. And a lot of people who are members of the coalition, that are members through their work or their organizations, they're younger people. So we need to have those individuals that can speak for their older family members, their neighbors, people who don't know where to go, or maybe they just heard them talking on the lawn. It's like, oh, I never thought about that. Maybe they can bring those issues to the table, things that's going on. So that's how it includes everyone in the community as an individual.
Yeah, and thank you for bringing that up. Our seniors are our most treasured resource, in my opinion, because of the wisdom and experience that you have. And so I'm grateful again that you share that with us. So the coalition has quite a bit going on right now. And you in particular are leading an effort to reach the African-American community, talking about COVID-19 through webinars. Can you share what's happening on that front?
Through the Amplify Equity webinar series, the coalition decided right at the beginning of this pandemic that the coalition needed to help get information out, accurate information, because there were so many things coming out on the news and just in organizations. And the coalition decided to put together webinars that addressed different parts of the community, the Asian community, the Native American community, African American community. And what we're trying to do in the African American community at this point, besides to make sure that they have accurate information, is to talk a little bit about vaccine hesitancy, because there's a lot of people out there, and not just people that are in my age group, but a lot of our younger folks that they're still saying they're not going to take the vaccine. So we need to make sure that they understand the importance of getting the vaccine and how it will help the community, help us to move forward with our economy, and to make sure that we can open things safely, our children can get back to school, and to, again, to open the economy safely. So that's what the African Community webinar series are all about.
And when are they coming up? I know one's coming up pretty soon.
One's on March 24th. The next one, I believe, is on April 26th, and then May 19th. There's 3 series.
Okay, and what time?
We're also doing a series that the coalition is participating in with the African American community and domestic violence and COVID-19.
Oh, wow. Now, that's an aspect that we don't often hear brought up, but yeah, that's a big piece. Before we talk about that one, for the three that you mentioned for the community starting in March, what time do those happen?
Beginning in March, those series begin at 6:30 and they will run approximately an hour and a half.
Okay. So can people ask questions or is it all presentation? How do they run?
There will be a question answer period at the end. They can also submit their questions in the chat box, and they will be answered as time permits.
And can they just register on the website or Facebook? How do you get connected?
There will be information coming out through the coalition, and they can register through that website. There will also be Facebook Live during that time. So that information will all come out through the coalition communications.
Awesome. So you try to make it easy for people to get involved starting March 24th at 6:30 p.m. The next one will be April 21st and then concluding May 19th, all at 6:30 p.m. held via Zoom and Facebook. Wow. Well, these webinars certainly sound like an important asset to our community. What do you have planned for the future?
Well, what we would like to do with the series, to continue the series on vaccine hesitancy, is to get it into the African American churches. Everyone loves their church, everyone loves their pastor, and a lot of our community members, maybe they don't have access to the internet or they don't have smartphones. So we want to make sure that we reach those people who need to talk to someone about the vaccine, the myths, the facts as well. And maybe we can get into the churches, maybe after their church service one day, we can come in, have a professional talk to them and be able to answer all of their questions about this vaccine and whether or not it's safe for them to take. So that's something we have coming down the pike, hopefully, and that we can get the community involved and participate with us.
I love that. And I'm just going to tell you now, count me in. I'm happy to help in any way that I can. Community Partners for Better Health is definitely on board with anything we can do, bringing health information to the faith community, because that is our mission as well. So I'm excited about it. I think that's going to be great. And I can't wait for the first webinar on March 24th.
Yes.
Perfect. Now tell me more about the African American community and domestic violence webinar.
The domestic violence seminars are also being held through the coalition, and the focus will be COVID-19, domestic violence during the pandemic. So there's a lot of things that are happening right now with individuals being sometimes locked in their house with their abusers. So there's going to be quite a few tips on what to do, how to stay safe, and of course, resources where people will go. So that will be a series as well, sponsored through the coalition.
All right. Well, thank you so much for that information. The A Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. The Health District has several local diabetes prevention resources, including a free 6-week self-paced online class for those who have prediabetes. To sign up, visit www.gethealthyclarkcounty.org or call 702-759-1270. This is A Healthier Tomorrow, and the reason we are sharing this information is we believe in creating a healthier community, not just tomorrow, but starting today. I want to thank you for listening to A Healthier Tomorrow radio program presented by Community Partners for Better Health and sponsored by the Southern Nevada Health District. I'm so grateful for the opportunity to share this vital information for our community. I hope that you take it in and share it with everyone you know, because a healthier tomorrow begins with you. And I want you to know you make a difference. Yeah, you matter. You are not just a drop in the ocean. You are the entire ocean in a drop. I want you to be well, and most of all, be compassionate. I'll see you right here next month, the second Wednesday of every month at 9 a.m. right here on KCEP. I'll see you then.